promise, I swear. Wherever you go, just always remember that you got a home for now and forever. And if you get low, just call me whenever. This is my ode to you. Wherever you go, just always remember you're never alone. We're birds of a feather, and we'll never change no matter the weather.
Hey guys, and
This
welcome
is
to
my
One
ode to
Side. I
you.
have the kids loose. I'm just in the living room, so you're going to see them a little bit. Today, I am 25 weeks pregnant and 1 day, and just wow, we have like 105 days left until my due date, which is just insane. I am okay. So symptoms that I have been experiencing this week are, number one, I feel like really, really big, and it's gotten to, I know I've said that for the past couple weeks, but it's gotten to the point where I'm kind of having trouble breathing. It sounds awful, but sometimes, like, if I get up too quickly or if I walk around a lot afterward, I'm like really like having to catch my breath. And I remember feeling that way when I was pregnant with Charlotte, but not until the end. Like, if you watch some of the pregnancy updates that I did when I was pregnant with Charlotte, for sure in week 40, you can hear me, like, with talking, every couple of words, I'm like really out of breath. And I know that I'm a lot heavier this time around in my pregnancy, so I'm sure that that has something to do with this out of breath feeling. But it's just funny, and it'll definitely be interesting to see how I feel the further along I go. Another symptom that I have been feeling is I am just feeling really, really tired in the morning. It is hard for me to get going. I know he's not huge right now. He's not even 2 pounds yet, which worries me when he gets bigger, how tired I'm gonna feel, because like right now I go to bed maybe around 10 or 11 o'clock at night. I wake up usually by about 8 in the morning, and I am just exhausted, like exhausted. It's as if I'm not sleeping at all. A symptom that I am not experiencing this time around so far, knock on wood, I have yet to have that insomnia, which I had that with Charlotte, where literally my nights turned into my days and my days were my nights. I'm really hoping that that doesn't happen this time around, because I'm going back to work finally, probably on Monday. So I'm going to be working full time, and I go to school full time. I need to make sure that I'm getting enough rest in order to function, really. So, so far it hasn't happened to where I absolutely cannot sleep, and I'm really hoping that it doesn't. But we'll see how it goes. Henry's moving activity is a lot. I am really, really excited about the doctor's appointment that I have next, which I did have to reschedule it because I am going to be going to work full time. Normally my appointments are always on Tuesday, and now my appointments are going to be on Saturdays because I'm going to only have weekends off. So I changed my doctor's appointment from September 20th to September 24th. And at that point, I'll have the ultrasound, and they'll do my glucose test, and we'll see how it goes. And I'm kind of nervous this time around to see how I do on the glucose test, because although my blood pressure has always been good, I am worried about getting pre-eclampsia, and I'm worried about having gestational diabetes. So I'm hoping that it turns out okay. There's not really a reason, aside from, like I said, the weight increase, of why that could happen. happen to me. But I'm just trying to stay as healthy as possible, you know? My appetite has definitely increased. I said last week I am not worried at all that I am not gaining weight because I'm eating a lot. I still get sick every once in a while, like to the point where I'm throwing up, but it's not anything serious at all. I just have to really make sure that I'm not overeating, because during the times that, like, if I eat my food too quickly or if my eyes become bigger than my stomach, that'll make me sick and cause me to vomit. So I have to be careful. I'm gathering, getting clothes and mittens and all that for Henry. And Charlotte's birthday is coming up in a few days, so that'll be exciting. I can't believe I'm going to have a 3-year-old. It's just insane to me how quickly this time goes. But in any case, let me go ahead and show you my 25-week belly. 25 weeks. That's crazy. All right, here we go. So, as you can see, I'm like humongous. Okay, let's go this way. 25 weeks. Right. And this side. Oops. I'm standing on my tippy toes. This way. Alright, thanks so much for watching, guys. Have a good day.